All right, welcome back, everybody. Our next speaker is going to be Dr. Lin, and she will be talking about nutritional impact on neurological inflammation.
Good morning, everyone. Thank you for coming to this session. I know there's a lot of options in this conference, so I appreciate you coming for this 30 minutes with me to talk about nutrition and brain health. My name is Yufang Lin. I am an integrative medicine specialist at Center for Integrative and Lifestyle Medicine in Cleveland Clinic. And I am grateful to be working with a group of providers who provided integrative medicine modalities for patients. One of my colleagues spoke this morning, Stephanie Whiteling, and so she talked about the different modalities. My talk for this 30 minutes is going to build on top of hers. But for those of you who were not here this morning, I would like to start with an introduction of integrative medicine. Since I moved the mic, can everybody hear me okay? Perfect. So integrative medicine is a medical modality in which it teaches the provider to combine allopathic medicine, which is what you usually get from your conventional doctors, with modalities from complementary medicine. So think about what Stephanie talked about, the Chinese medicine, the Ayurveda, the botanicals. We also talk about mental health, etc. The idea is we want to use those tools to guide patients to a better health. And for us to do that, there's two things we focus on. The first is we evaluate patients holistically. I need to get to know you. I don't really want to just treat a disease. I want to know what happened to you in the past that led you to developing this disease in the present moment. And the other thing I need to figure out is what are something that potentially that's happening right now that continue to drive this disease. Also, what can we do to change the trajectory of this disease? What can we do today to improve your health for tomorrow? So with that, our goal is to generally eliminate triggers that's driving disease and also support your healing. And we use that mostly through lifestyle. So if we think about Parkinson's, this is a general concept conversation. If you think about Parkinson's, it is a disease of nerve degeneration. So one of the things we started thinking about is, well, what are the common triggers that drives nerve inflammation, and can we reduce it? So this slide just lists a few issues. It's not comprehensive, but this is how we started thinking about and assess patients, right? Does this person have chronic sleep issues? Most of you know, if you don't sleep well, what happens to your thinking? What happens to your memory? What happens to your mood? Right? You get a little bit more irritable, it's hard to remember things, it's hard to recall, it's hard for you to learn things. So chronic sleep deprivation contributes to nerve inflammation, and it's been shown to increase risk of dementia. Chronic stress, same idea. If you're stressed, it tends to be harder for you to remember, to recall, because your brain is functioning a little bit more frenetically. So it also contributes to chronic inflammation, and chronic stress also has been shown to reduce the size of hippocampus, the part of the brain that helps you make memory and recall, and also the part of the brain that helps you with executive function, the frontal cortex. So chronic stress also needs to be managed if people have chronic stress. And then if somebody have chronic diseases that we know that can contribute to inflammation and contribute to nerve damage, we also want to assess and manage that as well. Because if you have diabetes, if you have high blood pressure, if you have heart disease, if you have autoimmune disease or other disease that's contributing to inflammation, the bottom line is the body works as a whole organ system together. If part of the body is inflamed and is not well controlled, then brain also become impacted no matter what. So we want to work with people on minimizing those where possible. Now, we also want to look at what are they encountering day to day that might be driving inflammation and driving disease. And Stephanie mentioned toxins, and I don't want you to overthink or over worry about it, but it is important to just be a little bit mindful of it. There are certain chemicals that are known to contribute to nerve injury. So mercury, for instance. Who here eats tuna? Right, how often do you eat tuna? If you eat tuna more than 2 times a week, hands up. No, that's great. Because some food, like tuna and swordfish, have higher amount of mercury. So ideally, you want to limit mercury intake, just be very thoughtful about what food you're eating. Now, arsenic. Who here eats rice? How often do you eat rice? Do you pay attention where does rice come from? Right? Depending on the type of rice and where it's grown, it has increased risk of arsenic. In fact, pediatricians now do not recommend rice. We used to recommend rice as the first type of food to introduce to babies. We don't do that anymore because the rice has increased risk of arsenic. So just so you know, if you're interested, stick with basmati rice because there's lower risk of arsenic, and look for rice that are grown in California or India because they're known to have lower risk. Now, this may change over time, but just start thinking. Sometimes it's just about paying a little bit more attention. All right, so pesticides and herbicides, things like glyphosate, also has been shown to have concerns for inflammation, neuroinflammation, also increased risk of cancer. Again, I don't want you to overthink this, but think about, are you putting this in your yard? Can you reduce that? Are you buying food organic when you can? If you can't, can you wash it really well? And can you peel? Can you scrub? All those can also reduce the pesticide exposure. So we take people through that conversation. But for today, this 30-minute conversation, my focus is on nutrition. Okay? There are food that we're eating that can drive inflammation. Conversely, there are also food that we're eating that can reduce inflammation. So think about what you're eating every day. Is it supportive? Is it nourishing? Or is it hurting you? What we eat matters, and you're what you eat. Who here has heard of leaky gut syndrome? Some of you. So I want to bring this concept up just for your thought, because this can help you understand why we focus so much on diet. Leaky gut syndrome is also known as increased intestinal permeability. It's basically saying that the gut lining is a little bit more permeable or leaky. And working around this topic actually has been shown to be quite supportive for people with chronic disease, and you'll hear a little bit more about that later. I want to go through this concept by introducing you to this slide and then walk you through this slide. This is from a review article that talked about the gut and brain health. So let me orient you to this first. I don't think I have a pointer, but if you look at the bottom membrane, that layer of membrane, that's your gut lining. When you spread out the gut lining, it's about the size of tennis court to double tennis court. It's really quite large, but it's very thin. It's only one cell layer thick. And each cells are zipped together by something called tight junction protein. So I think of it like a zipper that literally keeps the cells nice and tight together. When that zipper is nice and tight, the gut lining is intact, it protects us, and stuff in the gut lining doesn't leak across willy-nilly. And that's very important to keep in mind. Now, on the bottom of that gut lining is your intestinal tract, and you'll see that little golden yellow, that's actually your mucus. The gut lining produces mucus to protect your gut lining. And then below that layer of light yellow, that's your gut microbiome. The bacteria in the gut lining actually does a lot for us. It produces vitamins for us, it helps us digest fiber, it also protects the gut lining. And then below that is your gut lining. On the top, that's a membrane called blood-brain barrier. That's a membrane that protects our brain. And the membrane in the brain also has tight junction. And that tight junction in the membrane serves to protect our brain additionally by filtering out irritants and chemicals from our blood vessels, the blood that might be coming in. So brain on the top, the gut on the bottom, everything in between is everything in between in your body. So think about your liver, think about your muscles, think about your heart, think about your kidneys, think about your skin, okay? The gut and the brains are connected through our circulation, but it's also connected through our nervous system, which is in the center of the slide. It's also connected through our hormones and our neuroendocrine systems, our stress hormones, and it's also connected through our immune system. What this article was pointing out to is, if you look at the left-hand side, when you have healthy gut lining on the bottom and the tight junction is clean and intact, the blood-brain barrier is clean and intact, and the brain is protected. If you look at the right-hand side, and I know it's hard to see, over here, the right-hand side, the cells are a little frayed. The tight junction between cells are loose. So now they're leaky. And when they're leaky, stuff in the gut can leak across to your body. So think about what's in your gut. Is it food you're eating? Is it bacteria in the gut? Is the waste product? It leaks across. And when it leaks across, it's going to contribute to cause some inflammation in the gut. It's almost like a mini stomach bug, gut infection. Now, this happens with us, every single one of us periodically. It's not a big deal. Our gut is fantastic at healing this. The problem is if this happens over and over and over again. Then the thing is, because of how big the gut lining is, two things to keep in mind. 80% of our immune system actually sits in the gut lining. So when the gut is inflamed and the immune system is triggered, that immune response is going to leak into the rest of the body. It's going to trigger inflammation in the rest of the body. And the other thing I want to point out is the gut lining also have nerve cells, and that's very important, and we'll talk a little bit about that later. But when you have leakiness in the gut lining, it's going to trigger inflammation in the rest of the body, but also then it increases the risk of leaky blood-brain barrier, and that triggers inflammation. Okay? So then it's important to think about what might contribute to leaky gut syndrome or increased intestinal permeability. There are a lot of different reasons. This article is pointing out that food matters. So if you see on the left-hand side, the food people are eating, they're supportive for healthy gut lining. Vegetables, fruits, beans, right, legumes, whole grain food contribute to healthy gut lining and healthy brain, reduces inflammation. But if you're eating food that are highly processed, that have a lot of sugar, a lot of food additives, that also contribute to inflammation, then that causes leaky gut syndrome and leaky blood-brain barrier and brain inflammation. It's not always about the food, just to point out that if you are someone who had been on a lot of antibiotics in the past for a number of different reasons that changes the gut microbiome, that does play a role. If you're highly stressed all the time, if you're not getting enough sleep, again, there are other things that can contribute to leaky gut syndrome. But food is the low-hanging fruit. We all have to eat, right? We all eat every day. Every day we make choices about the food they're eating. And I want you to think about that. Are we making choices that are supportive, or are we making choices that are harmful? Now, just in case I lose you down the road, I'm just gonna say, the idea with healthy diet is eating well 80 to 90% of the time and still be able to splurge 10 to 20% of the time. There's no food that are intrinsically bad for you, but the idea is if you do well most of the time, you're gonna be better balanced, it's gonna be more supportive. Okay, so again, I don't want you to be too caught up with avoiding this and avoiding that, but again, can you move into the direction where you're more nourishing your brain rather than hurting your brain? Yeah? I am so sorry, I cannot hear you. And we don't have a lot of time for questions, but maybe just if you want to read, maybe we can do that afterward. I'll just see if I can save a few minutes at the end. Okay, so I'd like to share a theory with you regarding the origin of Parkinson's disease. This is not proven, but it's a very interesting thought. So there's a group of researchers, Dr. Brake, I think it's in Germany. They came up with a theory about the origin of Parkinson's disease. And what they noticed is that Parkinson's disease is a state of nerve inflammation and degeneration in the basal ganglion. And in those individuals, there's something called Lewy body in the brain, right? Now, Lewy body is basically broken. If you think of it as broken protein that kind of stuck in the brain and then prevent the brain to function well. And what they notice is that Lewy body actually can show up in the nervous system in the gut, 10 to 20 years before Parkinson's disease. So they thought, well, is it possible that the disease process started in the gut? And also they found the same thing in the olfactory nerve, so the cranial nerve in the nose, right? So they thought maybe it started elsewhere and then kind of travel up the nervous system. I don't know that it travel up the nervous system, but it begs the question, is there a connection, again, between the health of the gut and how it impacts the nervous system? And study shows that if people have chronic constipation, they actually have higher risk of developing Parkinson's disease by 3 to 11 times. And that very often it shows up 15 to 25 years beforehand, 15 to 24. People with inflammatory bowel disease also have increased risk of developing Parkinson's by about 17%. Now, as the Parkinson's disease progresses, very often people have GI symptoms, constipation, early satiety, difficulty swallowing, hypersalivation. And it's thought this is because the nerve is degenerating. But again, I wonder, is it possible there's some gut dysfunction with gut microbiome, with food, that's also driving this process? So Dr. Mitchley at Bastyr University and her team surveyed 1,000 patients with idiopathic Parkinson's disease and asked them to score their Parkinson's disease severity and progression, and also report their diet. And I want to share her finding with you. This is, let me just orient you. If you look at the mean change of the pro-PD score, that's patients' reported score about their Parkinson's. And then on the left-hand side is the food they're eating. Now, if you look at the middle column, 0 is when the food does not impact one way or the other. If it's positive, that means the food's impacting their symptoms negatively. If it's negative, that means the food is impacting positively. Does that make sense? It's clear for everybody, right? So positive is no good. The worst thing are actually on the bottom, but I'm gonna start with the top because there's multiple studies that looked at dairy, and there's some concern that dairy actually contributes to increased risk of Parkinson's. Now, it's not all equal. It's really more milk. Dairy milk consumed, this is all like seven ounces or so every day, seem to increase risk of Parkinson's by about 17%. But it's less with yogurt, less with cheese. So I don't want you to eliminate dairy because dairy is an excellent source of protein, excellent source of calcium. But I do want you to think about eating dairy that are healthy. So think about eating Greek yogurt, think about aged cheese, trying to avoid just simple milk, like basic fresh milk, possibly because of the sugar, possibly because of the protein sensitivities. But if you ferment dairy, it's better tolerated. And again, aged cheese makes it better. Try to avoid processed cheese. Think about that cheese that comes in the little pre-slice that's in cellophane wrap. Try not to do that, okay? The food that are known to contribute to more problems, though, are on the bottom. So that's the canned fruit, the canned vegetables, the diet soda, fried food, and if you go up, there's also soda and beef. Why can those be a problem? Canned food are made with usually aluminum cans, and it's lined with a plastic liner. That plastic liner very often has something called bisphosphenol A. Bisphosphenol A, BPA, has been taken out from baby bottles because it's known to contribute to hormone imbalance. It causes what they call endocrine disruption. And it's been shown to increase weight gain for babies. So they actually eliminate BPA from baby bottles. But it's still in a lot of plastic containers and canned liners, et cetera. So canned food can be a problem. If that liner breaks down and the food come in contact with aluminum, and if you're eating food that are very acidic, like tomato sauce, the aluminum can actually seep into the food. Aluminum can be neurotoxic, okay? Fried food, the frying of the food, particularly protein and fat, breaks the protein and fat and actually creates something called free radicals, which causes something called oxidative injury, which causes inflammation. And so fried food is considered pro-inflammatory. And then if we talk about soda, well, soda, if you look at the label, there's a lot of food additives that's no good for you. But regular soda have a lot of sugar. Sugar contributes to insulin resistance, which contribute to inflammation, but also contribute to nerve damage. Diet soda with artificial sweetener is not any better because there's concern about artificial sweetener that can also cause neurotoxicity. And I think I have a slide on that, so I'll move on to that later. So if you step back and then look at your diet, there's plenty of study that looked at standard American diet, which is usually really rich in processed food, low in vegetables, low in fruits, low in fiber, high in simple sugar and starches, and find that this type of dietary pattern contribute to increased weight gain, obesity, heart disease, diabetes, but also increased risk of osteoporosis, cancer, and dementia. And the big mechanism behind this is really because those food lacks nutrition and increased inflammation. So if you think about your diet, you want to reduce simple sugar if you can, and then focusing on real sugar, real food. So, honey, blackstrap molasses, maple syrup, those are sugar you can use in moderation because they have some vitamins and minerals in there. They're better for you. If you're using the food on the left-hand side, again, I'm strongly suggest you to use sugar in moderation, but avoid high fructose corn syrup. Because fructose needs to be broken down by the liver and it can contribute to liver inflammation. If you buy food that comes in a box or has a label, read the label because there are a lot of things that are added to the food that are sugar, but they don't tell you it's sugar. So those are all different names for sugar that can be added. One trick they do is they don't want the sugar to be the first ingredient, right? So they're gonna break down the different ingredient, different type of sugar. So you're not gonna see sugar as the first ingredient, but if you add the different things up, sugar is the first ingredient. So avoiding fake sugar. So aspartame, by the way, is a very common artificial sweetener people use. Part of the aspartame gets broken down into glutamate, and glutamate contributes to nerve injury. Okay, so if you hear people who have, when they eat MSG, and like if they go to a Chinese restaurant that has MSG, they have migraine headache, it's because the glutamate. Now, another thing aspartame gets broken down is formaldehyde. Why would you voluntarily take formaldehyde into your body, right? If you're gonna be using sugar substitute, a lot of people use the real sugar, or natural sugar. There are some concerns about those as well, but I would say it's in moderation is okay. But stevia, for instance, is considered natural. Stevia, though, has some negative impact on gut microbiome. So is the sugar alcohols like erythritol. So if you take them, it doesn't bother you, you want to continue, I would still suggest in moderation, but those are better options. Artificial sweetener is not just in food, it's also in your medicine. Read the label. Avoid food coloring. Ultra-processed food are also known to contribute to inflammation. In fact, increased risk of heart attack and diabetes and chronic diseases and death. And it's defined as industrial formulation of food that have 5 ingredients or more with food additives. And they're considered engineered food because they're not really, you take parts of food and put it together. They're not considered whole food or real food. So avoid those if you can. And then watch your fat. Now, I think we need some fat in our diet, but you want to make sure that's healthy fat, right? Think about olive, think about avocado, think about salmon. You want to avoid the fried fat, okay? Controversy about saturated fat, but generally you do want to limit saturated fat. I don't have too much time left, so I'm going to zoom through, but I just want to get some concept across for you. So the food that Dr. Matchley and her team found to be supportive, you can see here, vegetables, fruits, nuts, fish, olive oil. You can see down the list. With vegetables and fresh fruit on the top, it reduces their symptom progression by 40 to 50%. Why? Because vegetables and fruits have something called antioxidants. They reduces oxidative injury, reduces inflammation. They also have vitamins and minerals that are so critical for nerve function, and then also have fiber and complex carbohydrates, which are helpful for your energy, but also for your gut microbiome and also for your immune system. So eat more of those. And again, there are some nutrients that has been shown when it's deficient contribute to increased risk of Parkinson's disease. So have your food being more plant-centered. Get more vegetables, get some fruits. Have your beans, have your nuts and seeds. Mushroom is not a plant per se, it's fungi, but I put it in this bucket because they're also really rich in vitamins and minerals and healthy nutrients. Eat a diverse color of vegetables every day. Don't eat the same thing. We all fall into a rut, right? I know I'm eating the same thing all the time. Then you're getting the same nutrients all the time. You want to vary it up. So this way you get different nutrients. You don't have to have 7 colors of food every single meal, but you want to try to get at least 4 or 5 colors every day. Cook with spices. Spices have fantastic anti-inflammatory power. So whatever you have in your cupboard, if you're cooking with something, just throw it in there. Right? You can cook with them. You can also drink teas. So there are pictures on the right, that's lavender, chamomile, peppermint, and spearmint. They are anti-inflammatory, good for your mood, good at reducing inflammation in the brain, good for gut. So when we think about nutrition, it's not just about the food that you're eating, but also what you're drinking, trying to bring those into your diet. Have some healthy fat into your diet. Again, they are anti-inflammatory, rich in omega-3, which is supportive. And get enough protein. I see so many people, particularly after 50, 60 years old, not getting enough protein. We started losing muscles as we age. And muscles is so important for your overall health, through bone health, through muscle, and also for your brain health. So make sure you get enough protein every day. Now, you're supposed to get about 30 grams of protein per meal. So 30 grams of protein, if you're eating meat, is about the size of your palm. And if you're doing plant-based, you want to watch, it's a little bit trickier, but you can still get your protein through plant-based diet, but you want to dive into that a little bit further with the nutritionist to make sure you're getting complete protein, you're getting enough protein. So I do suggest people think about eating salmon as an excellent source of healthy fat and healthy protein. And also you can see it's really rich in vitamins and minerals, that's antioxidant and also supportive of nervous system. So your nutrition action plan is to reduce food triggers like simple sugar, excess saturated fat, but particularly avoid fried fat and avoid sugar, food additives and processed food, and really bring in vegetables and fruits and healthy fat and healthy protein. Now, if you're looking for a specific food plan, you can look at Mediterranean diet or the MIND diet. MIND diet is Mediterranean diet plus DASH diet. And I have a few slides, I'll just show this. If people want to take pictures, you can. But I want to point out there are a lot of different dietary patterns out there. They're controversial. A lot of people do keto, they're doing it for brain health. They are controversial because very often they're limiting in nutrition. So if you're going to be doing anything outside of this, I would strongly suggest you work with a nutritionist or someone specific to talk about the details, so this way you don't get into trouble. But if you're interested in Mediterranean diet, is food that you start with lots of vegetables and some fruits and healthy fat and healthy protein, and avoid ultra-processed food that we talked about. Now, Mediterranean diet does have wine, right? You can have some treats, but primary oil in Mediterranean diet, again, is olive oil and fish. And Mediterranean diet has a lot of data for reducing chronic disease. So this is just to show you the data behind it. MIND diet, again, is Mediterranean plus DASH. So the goal here is to increase nutrient-dense food and minimize high-sodium food, meat, fried food, pastries, and sweets. So for the next 2 slides, they're specifics. You're welcome to take pictures if you're interested. I think there are 3 slides here. I won't read it. All right, so I think that was it. One last thing, somebody did ask me about caffeine. There's some data that suggests caffeine can reduce the disease, Parkinson's disease progression, but you wanna do this in moderation because it can contribute to high blood pressure, palpitations, anxiety. So use your own judgment, but green tea has more benefit than coffee if you're gonna be drinking caffeinated product, because there's something in green tea that also lifts your mood, like L-theanine. Okay. So this is what I want you to walk away from today's conversation, that Parkinson's disease is characterized by inflammation and degeneration of the nervous system, and you can impact the disease progression by removed food triggers, such as sugar, processed food, canned goods, fried food, and nourish your brain with anti-inflammatory, nutrient-dense food. Now, if you are interested in seeing us or have additional, discussion or have some of the modalities that Stephanie talked about, this is our contact. So thank you very much.